Welcome. In the spotlight today with us is Dr. James Perrin, who was formerly the Director of General Pediatrics at Massachusetts General Hospital for Children, and he's currently the President-elect of the American Academy of Pediatrics. At Mass General, Dr. Perrin is founder and director of the Center for Child and Adolescent Health Policy. Jim, you're President-elect of the American Academy of Pediatrics. In brief, what's the mission of AAAP?
So we're mainly really in business to try to improve the health and well-being and outcomes for children. That's what our real desires are, to do whatever we can to make children healthier, happier, more productive as they grow up. This is a really important time in American history and an opportunity to really influence policy in ways that will make the lives of children and of pediatricians better. So that's really the reason I wanted to do this. I think this is a great organization. We need to build stronger relationships with a number of other groups, but we really think we can make a difference at this time in history.
What are you hoping to zero in on during this 3-year tenure?
So I think there are 2 or 3 things I'm particularly interested in. One is the Affordable Care Act is the law of the land. It has a lot of elements in it that are really good for children and for families and for communities. We're going to work very hard, point by point, moment by moment, to see that everything we can do to make this work for children and families happens. So that's probably the most important thing that I and my colleagues will spend our time on. But there are a couple of other things we're particularly interested in. One is, a lot of my work over the years has had to do with the increasing numbers, really the epidemics of chronic health conditions among America's kids. Real opportunities for prevention, real opportunities for really providing better comprehensive care to kids with autism or diabetes or asthma or mental health conditions. So that's a second theme that I really want to be working on. And I think the third one is one that the Academy is really entering into pretty aggressively right now, which is understanding more about poverty, childhood poverty, and how we know how childhood poverty affects the health of young people in dramatic ways. I think at this point we'd like to figure out what kind of role we can play to have some impact on poverty in America.